Hi friends, welcome to Nursing Online Education. In this video we will be discussing important questions and answers of different nursing competitive examinations.
This video is sponsored by Nurses Job Vacancy.
Guys, let's get started. Here is our first question.
When assessing for therapeutic effects of mannitol, the nurse would expect to see A. Decreased intracranial pressure. B. Decreased excretion of therapeutic medications. C. Increased urine osmolality.
D. 2-CREAZ sérum osmolality.
And the answer: A. Decreased intracranial pressure. Next question. Which drug would be used to treat a patient who has increased intracranial pressure, ICP, resulting from head trauma after an accident? A. Mannitol. B. Atropine sulfate. C. Epinephrine hydrochloride.
D. Sodium bicarbonate.
The right answer is A. Mannitol. Next question. Which of the following is the drug of choice for treatment of cerebral edema? A. Mannitol. B. Atropine sulfate. C. Epinephrine hydrochloride.
D. Sodium bicarbonate.
The right answer is A. Mannitol. Next question. The nurse would assess which laboratory value to determine the effectiveness of intravenous heparin. A. Complete blood count, CBC. B. Activated partial thromboplastin time, APTT. C. Prothrombin time, PT.
D.
The right answer is B. Activated partial thromboplastin time, APTT. Next question. The antidote to heparin is A. Aspirin. C. Warfarin.
B. Vitamine. D. Protamine sulfate.
The right answer is
D. Protamine sulfate.
Next question.
How do we monitor the effectiveness of Coumadin, warfarin? A. Monitor vital signs BPT, INRC weight D. Ask the patient how they feel.
The right answer is
BPT, INR.
Next question.
Which medication is used to treat a patient suffering from severe adverse effects of a narcotic analgesic? A. Naloxone, Narcan. B. Acetylcysteine, Mucomyst. C. Methylprednisolone, Solumedrol. D. Protamine sulfate.
The right answer is
A. Naloxone, Narcan.
Next question.
A patient who has been anticoagulated with warfarin, Coumadin, is admitted with gastrointestinal bleeding. The nurse will anticipate administering which substance? A. Vitamin E. B. Vitamin K. C. Protamine sulfate. D. Calcium gluconate.
The right answer is
B. Vitamin K.
Next question.
While admitting a patient for treatment of an acetaminophen overdose, the nurse prepares to administer which of the following medications to prevent toxicity? A. Naloxone, Narcan. B. Acetylcysteine, Mucomyst. C. Methylprednisolone, Solumedrol. D. Vitamin K.
The right answer is
B. Acetylcysteine, Mucomyst.
Next question.
If the nurse gave a patient antihypertensive drug that is prescribed for another patient, what should she do? A. Ignore what she has done. B. Call urgent CPR. C. Document that in nursing report. D. Inform doctor after 2 days.
The right answer is
C. Document that in nursing report.
next question.
When a physician orders an arterial blood gas, which artery is the appropriate one to use to obtain the specimen? A. Cerebral artery. B. Radial artery. C. Carotid artery. D. Ulnar artery.
The right answer is
B. Radial artery.
next question.
A client has an order to have a set of arterial blood gases, ABGs, drawn. The intended site is the radial artery. The nurse ensures that which of the following is positive before the ABGs are drawn. A. Hohmann's sign. B. Brudzinski's sign. C. Babinski reflex. D. Allen's test.
The right answer is
D. Allen's test.
next question.
A client is scheduled for blood to be drawn from the radial artery for an ABG determination. A nurse assists with performing Allen's test before drawing the blood to determine the adequacy of the A. Ulnar circulation. B. Carotid circulation. C. Femoral circulation. D. Brachial circulation. A. Ulnar circulation.
Next question.
A nurse has administered approximately half of an enema solution to a preoperative client when the client complains of pain and cramping. Which nursing action is the most appropriate? A. Raise the enema bag so that the solution can be instilled quickly. B. Clamp the tubing for 30 seconds and restart the flow at a slower rate. C. Reassure the client and continue the flow. D. Discontinue the enema and notify the physician.
The right answer is
B. Clamp the tubing for 30 seconds and restart the flow at a slower rate.
next question.
When caring for a client who is receiving total parenteral nutrition, TPN, which of the following complications would be most important for the nurse to assess? A. Chest pain. B. Hemorrhage and air embolus. C. Pneumonia and hyperglycemia. Electrolyte imbalance and sepsis.
The right answer is
Electrolyte imbalance and sepsis.
next question.
A client has a nasogastric tube after a gastric resection. The nurse should expect to observe A. Vomiting. Gastric distension. C. Intermittent periods of diarrhea. D. Bloody drainage for the first 12 hours.
The right answer is
D. Bloody drainage for the first 12 hours.
next question.
While assessing a client with hypoparathyroidism, the nurse taps the client's facial nerve and observes twitching of the mouth and tightening of the jaw. The nurse would document this finding as which of the following? A. Positive Trousseau's sign. B. Positive Chvostek's sign. C. Tetany. D. Hyperactive deep tendon reflex.
The right answer is
B. Positive Chvostek's sign.
next question.
Which of the following clinical manifestations of type 2 diabetes occurs if glucose levels are very high? A. Hyperactivity. B. Blurred vision. C. Oliguria. D. Increased energy.
The right answer is
B. Blurred vision.
next question.
Which of the following would the nurse expect to find in a client with severe hyperthyroidism? A. Tetany. B. Buffalo humps. Exophthalmos. D. Striae.
The right answer is
Exophthalmos.
next question.
A client is receiving long-term treatment with high-dose corticosteroids. Which of the following would the nurse expect the client to exhibit? A. Weight loss. B. Pale, thick skin. C. Hypertension. D. Moon face.
The right answer is
D. Moon face.
next question.
After undergoing a thyroidectomy, a client develops hypocalcemia and tetany. Which electrolyte should the nurse anticipate administering? A. Sodium, phosphorus. B. Sodium, bicarbonate. C. Calcium, gluconate. D. Potassium chloride.
The right answer is
C. Calcium gluconate.
next question.
The nurse who elicits a positive Chvostek's sign would suspect that the patient has which condition? A. Hyperkalemia. B. Hypocalcemia. C. Hypercalcemia. D. Hypernatremia.
The right answer is
B. Hypocalcemia.
next question.
Which of the following is the best method to decrease confusion and irritability for asthmatic patient? A. Give antibiotic. B. Give sedative. C. Give vasodilator. D. Give oxygen. D. Give oxygen.
Next question.
Which one of the baseline vital signs that has the most effect on SpO2? A. Heart rate. B. Respiratory rate. C. Blood pressure. D. Temperature.
The right answer is
B. Respiratory rate. Last question. A patient is admitted to the emergency department with a stab wound to the right chest. Air can be heard entering his chest with each inspiration. To decrease the possibility of a tension pneumothorax in the patient, the nurse should A. Position the patient so that the right chest is dependent. B. Administer high-flow oxygen using a non-rebreathing mask. C. Cover the sucking chest wound with an occlusive dressing. D. Tape a non-porous dressing on 3 sides over the chest wound.
the right answer is
D. Tape a non-porous dressing on 3 sides over the chest wound.
Thanks for watching. Subscribe for more videos.